rising number of heart issues in India these days, especially with youth.
People from Indian race have heart attacks 10 years earlier than the natives of that area. Whether it is from England, from Singapore, some amount of desi ghee is not bad for you. But this repeated boiling of oil,
it even gets cancer.
it is cancerogenic. It causes increased heart attack. People who have a type A personality, people who are in conflict with themselves, who are agitated, who cannot manage their time, those are the people who have heart attacks more often. Firstly, these protein powders are very dangerous.
Okay, it's bad?
Yeah, because these protein powders invariably contain anabolic steroids. Anything that you will try to break the nature and you will try to have rapid results has
something you gotta pay with something.
Yeah. Punjab, mind you, has the highest prevalence of diabetes, high blood pressure and heart attack in the whole country.
Any myth that you would like to break?
Patients initial time they waste 6 to 8 hours thinking that it's a gas, and by the time they reach
too late. In India, people think papad is healthy.
So it's a way of life. So
they say it's like a blotting paper, pura oil खींच
but
लेगा.
you know it's all salt.
That's also a myth. Hi everyone, welcome to our channel, and today we have a very special guest with us, Dr. Gurpreet Wander, and he is a very renowned cardiologist. He has done great work in internal medicine, and we are very obliged to have him with us today. Hello doctor, how are you?
Hello, thank you for having me on your show.
It's a pleasure to have you with us today. So you've done incredible work in medicine, and I would like to ask you, what made you want to become a doctor?
See, firstly, it was my father was a doctor and he was a physician, and I used to see him curing patients, and since childhood that had a lot of impact on me, because I used to see patients getting cured, and it was a way of life actually in our family. I have two sisters, both became doctors.
All right.
So in that sense, medicine
so
came
it's a
natural.
family of doctors.
Right.
But why cardiology?
Cardiology, because during my medicine training at PGI Chandigarh, I realized that it's the field out of all subspecialties of medicine. This is a field in which you can save maximum lives. Because patients can, the procedures that you can do in this field are very rewarding, and virtually they are life-saving. The second big reason is that heart attacks and heart disease is responsible for 30% of all mankind deaths. So in that sense, it is the commonest system by which all of us are kind of...
Yeah, 30% is a big number.
Yeah. It's the commonest cause of death amongst adults. Human beings. And also in cardiology, we feel that patients come very sick, and you can really, there are many other branches in which you cannot do too much for a patient. But here you can virtually cure, you can control diseases. So that is what, to a young physician, it gives more kind of an inspiration to take to this field.
And we see a rising number of heart issues in India these days, especially with youth.
Well, absolutely, yeah. I agree with. See, you've used two words, India and youth. I will address both of these separately. Because there is a notion amongst people that India has less heart disease, but it's actually the other way around. You know, Indians have been always migrating, especially Gujaratis and Punjabis have been migrating to all parts of the world. And in the early part, when Gandhiji went, people used to go to East Africa. Then, you know, Singapore and Malaysia in the mid-50s. Then 60s, people started going to England. Now, from all these countries, it's been shown that South Asians would include us, Pakistanis and Sri Lankans. We all have a gene amongst us, what is called as a thrifty gene.
So it's genetic.
It is genetic. And people from Indian race have heart attacks 10 years earlier than the natives of that area. Whether it is from England, from Singapore,
and it's
from
always
Canada,
been like that.
It is a well accepted medical fact that South Asians have the highest prevalence of disease. The reason is that our forefathers used to live in famines. And our body metabolism is not attuned to adjust to the amount of caloric exposure that we are getting now. The high amount of calories that now Indians have started consuming, we were not actually tuned to this. So for this reason, we are also the highest prevalence of diabetes. Now, diabetes is one of the risk factors for heart attack.
It's all
it is all genetic.
But it's on a rise.
It's on a rise, and as you said, amongst youth, the commonest cause is addictions actually. And out of these, you see, smoking is very prevalent in some societies. Smoking is the number one cause for heart attacks in the young people. But more than that, India has a very high prevalence of chewable. People take a lot of chewable tobacco. This chani, khani, and all these parags. And
so that really contributes.
Yeah, chewable tobacco is as harmful as smoking is.
Or even more maybe.
Even more because you consume more. And add to that the e-cigarettes which have come. There is some sort of a complacency amongst youth. And it's being propagated that e-cigarettes are safer. They are as harmful as cigarette smoking or BD smoking.
I remember I was reading some article. It says it's even worse.
Absolutely. So amongst youth, we see a lot of heart attack, especially those substance abuse is a very common cause.
But a few section of people believe that it's because of the COVID vaccine. Is there any link to that?
Well, that is an over-exaggerated thing. COVID, see, any infection, whether it is a routine influenza or any viral infection, it causes inflammation is a forerunner to acute events. So since COVID was a lot more common than others, so more thrombotic episodes occurred. Now, when you will give a vaccine for any disease, what is vaccine? Is you are giving antigens of that disease, that organism, in a smaller form, so that the disease does not manifest, but the body produces antibodies. So vaccination is what saved the world actually.
True.
But somehow it became prevalent. People started saying that it's the vaccine which is, and you know, there were lobbies even in the West, even in the Western educated society, there were some lobbies which said,
they believe.
So the high increase in heart attacks is primarily, see, 50% of the factor is genetic, what we just discussed, but 50% is our lifestyle. How we now, heart attacks are not due to one infection. Heart attacks are due to there are 8 factors what we call as risk factors. And now amongst these risk factors, high blood pressure is very important. Those people who have a blood pressure of more than 140/90, and
they are at risk.
Prevalence of hypertension is almost 25%. So 1 in 4 adults has hypertension, and we often teach our students that hypertension is actually a silent killer. Unless somebody goes and gets the blood pressure checked, one won't know that you have high blood pressure. So high blood pressure is a very important risk. Tobacco smoking, I told you second. Genetic risk factors, we just said. Obesity is the 4th important risk factor. People, you know, Indians have this central pattern of obesity. If you compare Indians with other races, you will see a European or a Russian who's evenly obese. But Indians will have a paunch.
Why is that? Genetics.
It is because you can actually virtually see from a distance, if you're going in a mall and somebody has a paunch, you can say this gentleman is more likely to have heart attacks. As compared to someone who doesn't have this.
So, but for our viewers, you have any suggestion how to make their,
See, diet is a very important factor. As even Bhagavad Gita says, you are what you eat actually. Of course, you are what you think, but you are also what you eat. And diet, see, what has happened is some of these fast foods which have come. Now, Indians are genetically, as I said, not tuned to the high calories. And over and above, we have very high carb eaters. All these sweets, these sugary things, they are the ones which are more harmful. Traditionally, whenever oil is burnt repeatedly, Like we often patients ask us which oil is best for me. We tell them that it's the sarson ka tel which is the best.
Okay, that is the best.
That is the best.
Okay.
No? Canola and sarson ka tel are the best.
But they say olive oil, coconut oil.
Olive oil, of course, is very good oil.
Even coconut.
Coconut is not that good, but olive oil definitely.
Okay.
Yeah, so olive oil and sarson, especially the kachi ghani olive oil, the cold pressed.
All right.
Now, if you will burn oil once, it will release oxidized fat, it will become.
All right.
But this kind of reheating which people do in vendors do, that is the one which is the most trans fats are formed in the body.
All right.
And trans fats are more detrimental than any form of oil that you take. Even desi ghee, you know, desi ghee has a lot of saturated fat.
Yeah.
Desi ghee, to a small extent, the ratio of omega-3 to omega-6 is not very bad in desi ghee.
All right.
So some amount of desi ghee
is good for you.
Is not bad for you. But this repeated boiling of oil,
it even gets cancerous.
it is cancerogenic. It causes increased heart attack. So as I said, fat intake is very important, and Indians actually take less proteins.
Yeah.
So if I have to give a general advice to your
Indian audience,
Indian audience, cut down on your carbohydrates, cut down on your fats, and go up on your proteins. And as you know, proteins are in chana, dal. People who take non-vegetarian, white of egg is very good source of. Yellow of egg is all fat.
Okay.
But white of egg is only protein. So white of 2 eggs is a very good. And then there are some vegetable proteins that you can have.
All right.
So diet is very important. As I said, exercise is a very important. People who take 45 minutes of exercise, at least 5 days in a week.
That's a must.
That's a must.
Yeah.
And the exercise is not the exercise that you do in a gym or in a charged atmosphere.
It can be like steps, 10K.
It can be steps.
Yeah.
It should be outdoor exercise.
All right.
It's the outdoor exercise which has a mind calming effect. So exercise is not just movement. There has to be a mind calming also.
Okay, you to align yourself.
Absolutely. Yeah. So yoga, meditation, the International Yoga Day is just on the annual now. In fact, we are celebrating the Yoga Week now. So meditation is another. So lifestyle is very important.
So you look very fit yourself. What is the...
See, I take a regular walk for the last 25 years.
All right.
And in fact, I would like to introduce you to a book of mine.
Okay.
Which is actually, this is based on a morning walk. This actually is a book on morning walk only.
Achha.
Yeah, it's a book in which every day we want our viewers or readers, like on April 9th, you will read this.
Contribute.
So these are normal.
So it's very motivating.
Yeah, it's very motivating. It talks about health issues. It talks about lifestyle issues. So this is a book over last 2 years.
Wow.
We just started collecting our morning discussions.
And it's very easy to read, I'm noticing.
Yeah. So this is...
Where can we get this?
This is on Amazon and it's on Twitter also.
Definitely,
I would like
order.
to present this book to you.
So
and also...
just a point.
Yeah.
Please zoom into this. It's amazing. If you need any motivation with your workout, your walks, you should definitely get this book. And you can see it's really easy to read, and there's like according to your dates, like this is June 4th. A sufferer needs help, not just compassion. So this is amazing.
So these are lifestyle things that in our day-to-day life that we
and you can get this on Amazon. Yes, and Dr. Gurpreet is right here. And we are so lucky to be sitting with you today.
Thank you. Thanks. It's a pleasure, in fact, to talk about health issues with the general public. Is preventive medicine is more important than curative medicine. People who come to us in the emergency of the hospital, actually half the battle is already lost. Because
it's too late.
It's too late. So I always make it a point, and it is upon all doctors to go to the public, tell them about, as you were just asking, what are the lifestyle measures that one can adopt with which the incidence of this heart disease can be reduced. And as we were talking, walk, regular exercise, diet, and the third important factor is stress actually. People who have a type A personality, people who are in conflict with themselves, who are agitated, who cannot manage their time. Those are the people who have heart attacks more often. And as you said, youngsters of late, we have had some very big celebrities also. One of the celebrity was playing polo.
Yeah, but
week.
it was due to a bee sting.
That
is
I think
true?
is just a bee sting will not kill a person.
It seems like an excuse maybe. I mean, I should not be talking like this. But
so
I don't
most
know.
doctors would believe it's a heart attack. Bee sting cannot kill a person.
And it could be bad lifestyle as well.
It's a lifestyle. Then see extremes of exercise.
Anything extreme
beyond 45 years will obviously expose an individual to increased risk.
Yeah.
Especially those who have never exercised. When they start exercise, for the first couple of months, they should go slow. They should warm up their body. They should see whether their body is able to take that exercise, and then gradually see what happens in gyms is firstly, these protein powders are very dangerous.
Okay, it's bad?
Yeah, because these protein powders invariably contain anabolic steroids. Anything that you will try to break the nature and you will try to have rapid results has
something,
to be, something
you gotta pay with something.
Yeah. So synthetic proteins, we discourage synthetic proteins. And we have seen actually so many deaths with these things like Red Bull and people who take energy drinks. Because anything that kickstarts, I have seen many kabaddi players actually, they inject some injectables like mefenteen is injected because it charges them and they can perform better in the field. But we have seen
these are all anabolic.
Yeah, these are all unnatural ways of
but even plant-based proteins
are very good.
Yeah, because a lot of celebrities and models are shifting to that.
So plant-based protein intake increase will really be very good for health for all Indians. Natural plant-based protein, that's what we recommend actually.
So Dr. Gurpreet is associated with DMCH, which is Dayanand Medical Hospital and College. So, doctor, I want to ask you, what is one thing that you've done with DMCH that makes you very proud?
So, I have been associated with Dayanand Medical College and Hospital for the last 30 years actually.
30 years.
And it is in 2001 that we started the Hero DMC Heart Institute. This is a 180 bedded facility. It is a state-of-art tertiary care center where we do all the procedures of cardiology that you can imagine. And our previous secretary, Mr. Premnath Gupta, it was his dream that Punjab should get a heart center so that people don't need to go to other places. And now today we are a 180 bedded hospital, but we have around 200 patients at any time. And we get patients from all around. I can proudly say that we are the center which is a tertiary level care and patients get state-of-art treatment here. We also have a DM program here in which we train young doctors, and most of the centers you will find in North India, they have doctors who have been trained from our center. Because for the last 14 years we've been running a DM program in cardiology. We now every year take 5 students for DM program. So this has been actually the most satisfying thing in the journey that I have had.
That's great. 30 years is a long time.
Yeah, it's been a long association.
You've had an incredible journey. I've read a lot about it.
Thank you.
Yeah, and I've been very thoroughly impressed.
Thank you very much for the kind words.
Yeah. If not a doctor, what would you have been?
I actually, as I said, I have always imagined myself to be a doctor. In fact, a lot of my friends often come and ask me what should they put their children into, and I have always insisted that this is a profession which gives you satisfaction, and it also gives you freedom to actually treat your people the best way, ethically, the best manner that you
So you've been laser focused in the beginning.
Absolutely.
Yeah, I think that is the way to be. If you keep too many options, then
I strongly believe if you are enjoying your work, any work that you do, I mean, if someone has adopted work as a hobby and one starts deriving enjoyment out of it, then fatigue will never happen. If you are not enjoying your work, then you might as well change that work. I have always enjoyed my work, always enjoyed talking to patients, managing them, seeing them get well and go home. That is something what gives you the most satisfaction and pleasure. So.
And I'm so sorry to be going back to the earlier topic, but you feel Punjab is at par with the metro cities to cure,
Punjabis, you see, the problem is, what I notice now is our diet has not really changed, and we have adopted the Western lifestyle. See, in India, prevalence of heart disease, diabetes, high blood pressure, all three in the villages was half of this, what was seen in the urban areas. And we have always been calling it as the rural-urban divide of the risk factors and the heart disease also. But now, since urbanization of lifestyle has happened in Indian villages also, now you see Indian villages are as much affected by social media, television, lifestyles have changed, they don't exercise, they have equal amount of stress, their diet is, as you see, all these McDonald's and Burger Kings and all these coming up even in the villages, and you find villagers actually adopting to this diet. So the urban-rural convergence has occurred in terms of heart attacks. So what the ruralites were having their benefit of being in the open and exercising, as people have started exercising less, the heart disease prevalence has increased. And Punjab, mind you, has the highest prevalence of diabetes, high blood pressure and heart attack in the whole country. So Punjabis have to change. Either they change their diet. We are still carrying on with the high fat diet of our forefathers who used to exercise a lot. Like my grandfather would never come from the bus stand to our house. He would always walk down. He would never pick up a rickshaw or something. What we are today doing is, you know very well, that we have stopped exercising as a society. But we haven't changed our diet. In fact, we are adopting to these kitchens which have come up. People don't cook in their home. The traditional diet of fruits, vegetables, and traditional diet is the way. If we want to, actually we have to go back to that diet. If we have to reduce
back to the basics.
Absolutely. And exercise. And the family structure that we had earlier. The grandparents were there, and we had strong family bonds, friends, hobbies. All those simple things we have to go back to, so that the stress does not actually operate as a big factor for heart attacks now.
Main thing is stress.
Absolutely.
And
stress,
your
diet and lack of exercise. These, as you are saying, are the three major factors. And we cannot say that heart disease cannot be prevented or heart disease cannot be delayed. If one gets regular health checkup, picks up blood pressure, controls, treats fat, diet one alters, one can delay the occurrence of heart disease also.
Nice. So there's any myth that you would like to break?
One thing I have seen, it makes me feel very sad at times, is the symptoms of heart attack are not known to the general public. So by your channel, I would really want, I'll just take 1 or 2 minutes only, that heart disease actually doesn't cause pain, it causes burning, heaviness, constriction. These are the three major kind of feelings that people get. And along with that, there is a lot of sweating. Now, what happens at times is that burping occurs and that relieves this distress. So people actually misdiagnose it as a gas in their...
they call it anxiety or gastric.
But if there is a pain, if there is a heaviness with sweating, with breathing difficulty, one must go to the nearest doctor and get an ECG done, because a heart attack, if it is treated within 6 hours, there are some drugs, there are some medicines
which can be controlled.
Life can be saved. But what happens very often is patients' initial time, they waste 6 to 8 hours thinking that it's a gas, and by the time they reach to the near, it's a little late. So never ignore symptoms like any kind of heaviness which is not getting relieved in 10-15 minutes, which is causing burping sensations, sweating is there, breathing difficulty, that needs to be paid heed to, and that patient. Now, if you keep aspirin tablet, as a first aid kit.
Okay.
And statins actually. So one tablet of aspirin, if it can be given, one pill can be given to a person,
Yeah.
it can save innumerable lives. Even if it is not a heart attack, one aspirin is not going to harm a person.
Okay.
Then these statins, what we call as atorvastatin. One tablet of atorvastatin, one tablet of aspirin, if it can be given to a person who has the, if somebody keeps a kit and gives this before the time person reaches hospital, still lot of lives will be saved. So public education, what you are doing now, is very important, because unless we make our people aware, you can well imagine how would they know what the causes of heart disease are. What do they need to do when these symptoms happen?
Yeah, I think you are a perfect example of how doctors are contributing beyond treatment as well.
It is upon us. Actually, I'll just tell you one experience in the world. Now, America had very high prevalence of coronary artery disease. They started a program called the Save Your Heart. And the doctors took it upon themselves, and they went to the public. The public was made aware actually that, and the prevalence of heart disease reduced
actually
in America.
Came down.
Whereas it is rising in India, it has fallen down in US and UK through public. And it's not the hospitals, it's not the treatment which is going to reduce it. It is the preventive measures which are going to, the public health measures which are going to make a bigger difference in terms of, see, if you start taking less salt. Now, salt is a precursor to high blood pressure. If we can educate our public that don't take baking powder, these pickles, papad.
Achha, even pickles.
Pickles is all achar. Achar is all
I love pickles.
Salt, no?
Oh.
Yeah. And this these days, youngsters like you, they consume lot of chips. Now, chips is all salt.
And all these Korean flavors and all.
Absolutely. So anything that has baking powder, has bakery, is all.
Okay, so bakery stuff is a no-no.
Less of bakery stuff, less of chips, less of pickles, papad. Now, salt is a precursor to high blood pressure.
Yeah.
And people who reduce their salt intake, they get less.
I've seen in India, people think papad is healthy.
Yeah. So, it's a way of life. So all
they say it's like a blotting paper, wo pura oil kheench
but
lega.
you know, it's all salt. It's all.
That's also a myth.
Yeah. See, simple diet, vegetables, fruits. Even all Western societies are now coming back to the vegetarian, to the traditional Indian food, and we are adopting there. So it's kind of they are adopting to yoga more than us. Although we have started the international yoga, but see how many Westerners are now. So the traditional Indian lifestyle was definitely better than what we have adopted now.
We got really good points from you today. And me and my listeners, I'm sure we all feel lucky. And we're going to make a lot of lifestyle changes. Like you said, less salt, more protein in your diet,
absolutely,
more exercise. It can be a simple walk as well. Doesn't have to be heavy lifting and all. And
stress management. So you said it actually. All these three things.
Just keep happy.
If we can, one can make a comprehensive, keep happy.
So, any book or any quote, any belief that's kept you going?
See, what I would like to tell my viewers is, there is a book by Dean Ornish, who showed for the first time that, see, people started believing a lot in drugs. And not many times patients start feeling that I am taking the pill and I am doing my responsibility. But Dean Ornish took up some people, changed all these factors which you and I have discussed. They made a lifestyle which was healthy lifestyle, and he showed that coronary atherosclerosis. See, in the heart arteries, there is a process what we call as atherosclerosis. The process of fat deposition in the coronaries is called as atherosclerosis. He could reverse atherosclerosis. So it's a medical fact. There is actually anybody can go and read Dean Ornish's book. It's very inspiring book, and most of the things in that are Indian lifestyle actually. All these things that we discuss. So I think that is one book which I would recommend to the general public to read, so that they themselves can know how heart disease can be reversed, heart disease can be delayed, and people can live a normal, healthy lifestyle even after having heart disease.
Okay, I think that will be great help. And any quote you live by?
Quote that I live by is keep it all simple.
Yeah.
Anything that you will keep simple in your life will be easy. And the second quote that I live by is be truthful and be transparent. If you are transparent, if you have nothing to hide, and if you are truthful, that is the best way to be stress free. Whenever anybody tries to hide something, anybody tries to make when we try to make a fool of someone, actually we end up making a fool of ourselves.
Because it messes with the nervous system. I get that. So any message you have for the medical students, the aspiring doctors?
Yes, sure. I personally feel that this is the best time to get into the medical profession, because what we learned 40 years back, that time medicine was at a very nascent stage. Today, a doctor with artificial intelligence coming and other databases being at their disposal, a doctor is much more effective in treating patients than what we were 40 years. So technology is going to help them a lot. Basic principles of medicine, that is to be compassionate, caring, honest, truthful, and communicative to their patients. What is happening, I see, in the medical profession today is we are imbibing technology, we are more attracted towards these new devices and new gadgets, but they are also bringing in a lot of misconceptions in the general public. Today we have a patient who is much more aware of his rights and who's more aware of the diseases. By the time they come to us, they've already read something about that. So as doctors, they have to be more communicative with their patients. Many years back, we had a very patriotic system in which we used to tell the patient that this is good for you. Patient would not challenge to us, and we got used to this particular system.
Now everyone has chat GPT.
So it's a deliberative system.
But don't you ever get irritated?
No, I think it's a time where we have to change. Changing times always need change is the way of life. Actually, is the only constant in life. And unless you change with times, how can you adapt to the new situation? In fact, it's more enjoyable. Somebody on the other side understands what you are. So you just spend a couple of more minutes and
you get your answer.
Your advice is better followed.
True. It's how you use it in a good way.
Absolutely.
But you think the students now, they have an easier way?
I think the students will definitely be able to manage their patients better. They will be more effective. But they should not get driven to the over enamored by the technology. They should not forget the basic principles of medicine.
You got to keep a balance.
It has to be caring still.
I'm sure the medical students, the aspiring students, they've learned a lot today from Dr. Gurpreet Wander.
Thank you.
So before we end the podcast, I want to make it a little fun with a little rapid fire.
Sure.
So you have to be prompt with your answer.
Okay, I'll try to be.
Okay. So doctor, pen or stethoscope?
Pen, definitely.
Okay. Any message for the youth?
Message for the youth is you set your own limits for yourself, because there are many digressions and diversions and attractions in the society, but the time that will be lost forever. So please follow the middle path. Maybe you want to experience, but don't experience things beyond, and you should always be in control of yourself.
Morning walks or yoga? I think morning walks after
both.
This. Both. Any guilty pleasure of yours?
Guilty pleasure, yes. Sometimes when we go out, we eat a lot, and then the next day you feel.
But what is your favorite dish?
My favorite dish is actually my wife.
Cheat day.
My wife always jokes with me. I am very fond of paneer actually.
Okay.
So
paneer is healthy.
It is, but
I thought you were gonna say something like butter chicken or ice cream.
When I was young, that time it used to be.
Not anymore. So it was a pleasure having Dr. Gurpreet Wander with us today. I hope you had a good conversation with us.
I enjoyed it.
It's been a pleasure. Thank you, doctor. May you keep doing the great work that you're doing. Keep inspiring us.
Thank you.
And I'm sure a lot of youth, a lot of people have gained a lot of wisdom from you today.
Thank you for sparing your time.
And viewers, don't forget this book, Just a Point, Musings at Dawn by Dr. Gurpreet Singh Wander. And you can get it on Amazon. It's going to motivate you. So please check this out. Thank you.